This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
The Colorado State EMS Annual Conference 2024 is coming up, and if you're in the EMS world, this is an event you can't afford to miss. Whether you're in pre-hospital medicine, emergency medicine, or involved in emergency services in any capacity, the conference offers something for everyone. You'll find cutting-edge workshops, expert-led sessions, and hands-on training that will cover the latest advancements in emergency medicine. And here's the exciting part. We'll be there too. Emergency Medical Minute is setting up a booth where we'll be sharing our mission of providing concise, evidence-based education to the EMS community. So if you're looking to sharpen your skills, connect with like-minded professionals, and stay on the forefront of EMS knowledge, mark your calendars for the Colorado State EMS Annual Conference 2024 happening from November 7th to 10th in Keystone, Colorado. We look forward to seeing you there.
So this is a case that we had a week ago or so. I didn't get a chance to talk about it that day, so it was kind of interesting. So this was a male, unknown age motorcycle accident, initially called in as a trauma alert. It's a kind of moderate mechanism motorcycle accident. Initially they said they had wrist deformities was the main problem. And then when the patient got here, they looked terrible and pretty rapidly turned into a trauma activation, was altered, and EMS was kind of fighting with the patient. The blood pressure had dropped since they called, so a lot had changed. So the patient looked pretty sick when they got here. We decided to RSI the patient, intubate, because they were really uncooperative, seemed really sick. And then the patient was tachycardic, pretty tachycardic, like in the 160s, not quite hypotensive here. And we got a couple of quick tests before they went to CT, and their chest x-ray showed a really wide mediastinum. So like the upper chest was very wide. And does anyone know what that should make you think about in a trauma patient? Tension pneumo would actually kind of cause the opposite. It would make your mediastinum narrow from the pressure. So what we think about with a wide mediastinum in a trauma patient is an aortic injury. And you can think about that anytime you have somebody with what we call a sudden deceleration injury. So like a car accident where you're going really fast and like smash into a wall, or a bad motorcycle accident where you decelerate very quickly, or a high fall. Those are kind of the main things you think about. And then the patient went to CT and it did show a really significant aortic injury, blunt aortic traumatic injury. And there's four kinds, and his kind was the worst, which is basically like an aortic rupture. And initially, kind of the initial management is kind of like what you think about with an aortic dissection. You don't want to have really high blood pressure or very fast heart rate kind of pushing on this really damaged aorta. So you start them on medicines to slow down their heart rate and their blood pressure. We did esmolol. You could also do other things like nicardipine, labetalol. And then you kind of see if they're stable or unstable. And there's questions that some people need surgery, some people don't. The more minor ones a lot of times get treated just with observation. The worst ones do get fixed, but some of them actually wait and do a delayed surgery. If there's any other injuries or if they're kind of stable initially, they might wait to do it. And the way to do the surgery has kind of changed. Now, like a lot of other vascular procedures, they do it endovascular. They used to do like big open thoracotomies for these people and do open aortic repairs. Now they do a lot of endovascular treatments. This patient was initially kind of stable, but quickly became unstable and got taken to the OR pretty quickly for a graft. And they were able to graft his aorta. Still very sick, like a week later in the ICU on multiple pressors with, on dialysis. So these patients have some pretty significant morbidity even after if they do survive the initial injury. Kind of a couple other interesting things just statistically. These kinds of significant blunt aortic injuries, about 80% of patients die before they make it to the hospital just because it's such a bad injury. Of the ones that do make it to the hospital, about 50% die in the first 24 hours even once they make it to the hospital. A lot of times that's from either just not able to fix the aorta or they have such bad injuries otherwise. So obviously kind of transecting or rupturing your aorta is not a good thing to have happen, and it does happen sometimes. But yeah, the big thing, like initially that chest x-ray, it's one of the reasons we do trauma chest x-rays initially is to look at the aorta and then get the quick workup for that.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.